morning. 5 months into this pandemic, we have doctors working diligently to find a vaccine and to learn as much as possible about COVID-19. In our country, in our community, we're used to instant results, fast food, Amazon delivery, or high-speed internet. But there is no really simple solution to COVID-19. Wishful thinking won't go away. It won't make it go away, but responsible actions will. And some of those responsible actions include getting resources to those who need it most in our community. And history is a persistent reminder that many individuals in our community don't have the same resources as others. In fact, in our country, we don't always do a great job of taking care of everyone. We know that our African American community sometimes falls short on many of the measures of life expectancy. For example, in some zip codes in St. Louis County, life expectancy can be as much as 35 years difference. At the bottom of the list is Kinloch, where life expectancy is 56. This is a town of a few hundred people that has been forgotten by many. And for those of you who came this weekend to help clean up Kinloch in an effort organized by State Representative Rachel Prouty, we thank you. We must not allow our communities to be dumping grounds for others. Years of disinvestment in some parts of our region often goes unnoticed by those who are neighbors who don't live close by. As we respond to the COVID-19 pandemic, it shines a bright light on disparities in our community. COVID-19 has had a devastating impact on African Americans in this country and here in this region. Underlying health conditions exacerbated by limited access to health care, limited access to health insurance, or healthy foods all makes fighting COVID-19 very difficult. But when we began this response, I said that we would be directing resources to those who need it most, the most vulnerable in our communities. And that's exactly what we've done. We've made sure that testing and mass distribution was available to everyone. We've granted more than $2.5 million to 5 agencies in our community that are providing food to needy families throughout the region. We've begun sending out checks to small businesses, and we have set aside $19.5 million to support our small businesses who have been hurt by this pandemic. We know that small businesses are where most of our jobs are in the community. And I do want to thank and recognize the county council members who have helped us identify those who need the most help. As I said before, this pandemic is actually 3 crises. It is a public health crisis, a humanitarian crisis, and an economic crisis. And in part of our response to the humanitarian crisis, we actually have a humanitarian response program. And in a week from today, we will announce $9.5 million of grants that will be allocated to support programs in our community, and some of the services that help our most vulnerable citizens. And across the country, we have seen COVID-19 test results start to increase. This is in part due to more testing and in part due to more people being out and about. And as we see more positive cases, this reminds us how important contact tracing is. In St. Louis County, we have over 260 individuals who are working in the contact tracing program. And through contact tracing, we were able to identify 12 individuals who were COVID positive who worked at the same manufacturing plant in St. Louis County. And this company in St. Louis County had been working diligently to prevent infections. Even before masks were mandated in this business, in this manufacturing plant. They had initiated social distancing measures to keep their employees spaced apart. They had rearranged spaces, and they had made sure that their cleaning surfaces, their hard surfaces were constantly cleaned. So you can imagine how surprised they were to learn that their employees were beginning to turn up positive. Our public health department, working with neighboring health departments, neighboring jurisdictions across 4 counties and 2 states, were able to trace these individuals back to the same manufacturing plant, the same shift, to learn that they took the same lunch break in the same break room. And in this break room, they were not practicing social distancing, and they were not wearing their masks. We have to remember, as we go back to our workplaces, that social distancing is important. There is no place in a building that is safe. Mask wearing is important everywhere. Breaks should be staggered, and we should maintain social distancing in these break rooms as much as possible. Break rooms contain a lot of hard surfaces, microwaves, refrigerators, coffee pots, all sources of contamination. So don't let up or stop being responsible. I know it's easy to lapse, but as long as this virus is in our community, we need to maintain our guard and do everything we can to prevent its spread. The fight against the virus requires everyone maintaining a safe distances, constantly cleaning hard surfaces, wearing masks when not, eating or drinking, and of course washing hands whenever possible. Aggressive contact tracing has proven to be an integral part of this process. It's important that if you get a call from someone, from a Department of Health, from our county or a neighboring county, and you are notified that you may have been exposed, it's important to return that call. Please cooperate. You might be helping to protect someone else. You might even be helping to save a life. Thank you, and I'd be glad to answer any questions.
Can you talk a little bit, we've gotten some calls and some emails from some people claiming that there are some businesses in the county that aren't enforcing the mask mandate. Is a fine or anything like that on the realm of possibilities to help enforce this?
So first of all, we would ask that they contact us through the STL Corona webpage if you see businesses not enforcing the mask mandate. And then we will help educate the businesses, provide them with signage, and help them communicate with their patrons and their employees what the guidelines are. We saw some of this early on with our business guidelines, but what we have found almost universally is that once we communicate with the business, then they begin complying with our guidelines. In fact, we have heard more from businesses who have been thanking us for this mask mandate so they can tell their customers and their patrons, look, this is a mandate, this is a requirement from the county health department, please put on a mask.
Is there any chance at all on your spectrum at this point that another stay-at-home order could be ordered here in our county?
Well, there's always a chance of more restrictions, but as a current practice, we aren't currently considering that. We're watching the pandemic task force. We're watching that hospital admission number. We're really focused more on outbreaks and making sure that we control those outbreaks, contact tracing. If there's a specific business that is affected, then that business may have to shut down. If we see a specific sector that is more involved than others, then we'll talk about closing or more restrictions on that sector. But right now we're going to focus on individual actions rather than community-wide actions.
Based on what you've seen thus far, when you look at the data present day, going back a couple weeks, do you feel good about schools reopening come August?
Well, with the information we have today, I think it's the right thing to do. Those guidelines were developed in conjunction with pediatricians, school superintendents, members of the pandemic task force, and our local public health officials. And that's how we'll make all our decisions, listening to the experts. But with the conditions we have now in St. Louis County, I believe that we have a path forward. If those conditions change, then we would certainly consider modifying our decision. Part of those guidelines that are published on stlcorona.com include contingency plans with individual students infected, staff members who might become positive, or even if there's an outbreak at the school, and they'll follow those contingency plans. Schools have the ability to modify our guidelines to make them more specific for their institution, and I expect that many of them will do that. We're not going to be making decisions about schools based on political pressure or any sort of national mandate. We'll do here in St. Louis County what we think is right, and those decisions will be made by our local officials, local superintendents, pediatricians, and public health officials.
Piggybacking on that, from Channel 5 about schools, what kind of feedback has the county received from parents about the reopening of schools?
Well, parents are concerned. First of all, they want their kids to be able to go to school. They understand that being able to go to school is an important part of success in life. And many parents are beginning to get worried that their kids will be falling behind. But they also want their kids to be safe. And that's always going to be our first priority, keeping the kids safe. But we believe that working with our superintendents, our pediatricians, public health officials, that we have a path forward, that we can begin this reopening process of schools with the information we have today, that we have a path forward, and that this will keep our kids safe. If our information changes later on in August or September, then we will adjust appropriately.
Anything else?
Other questions? Okay, thank you.